All right, we have Dr. Kim here today. She is a chiropractor here locally in Utah, and we're going to jump in and talk about all things about her business here. So, Dr. Kim was born and raised in St. Louis, Missouri. She grew up riding horses and competing in hunter jumper shows across the country. Due to multiple falls from her horse, her mom started taking her to the chiropractor when she was 11 years old. She never experienced the chronic back pain that her other equestrian friends started to have in their teen years, and credits seeing a chiropractor at a young age with keeping her feeling great now and free from chronic pain. She's also Webster certified, a technique specialized for caring for pregnant women, and loves to learn and continually seeking to expand her knowledge in perinatal and pediatric chiropractic care. She studied under multiple mentors, teaching perinatal and pediatric care to other chiropractors around the country, which has made her one of the best in her specialty. Dr. Kim is married with 4 kids and was blessed to have 4 incredible home births. She values pregnancy and the strength it takes to grow and deliver and raise babies. She supports a person's decision to birth in the environment in the way that they're most comfortable. And when moms have a better pregnancy and delivery, they have healthier babies. Healthier babies grow up into healthier adults. Could not agree more. So, without further ado, we'll jump right in with Dr. Kim here and ask her about what made her decide to become a chiropractor. She spoke on that a little bit in her bio, but jump into that a little bit more from like the passion side of it.
It was, I guess, through college. I kind of lived the college lifestyle, not planning to go into anything in the health field, actually looking at business. And I had mono and got some other health issues just from not being healthy and started looking more into the health side, switched my major to health sciences. Um, and then since I grew up 10 minutes away from the chiropractic school, I came home for a summer, visited it, and it just felt right. I originally wanted to go the sports side of chiropractic um, and even got my master's in sports science rehabilitation. But after I graduated, I just felt called to the family side. The prenatal and pediatric side is kind of what resonated more with me.
That's awesome. Awesome. Okay. What makes you different? Like there's millions of chiropractors. What
Right.
makes Dr. Kim different?
Um, so not just the Webster certification, because you can look it up. Webster certification is a weekend class, which is awesome. It's packed full of information on how to treat pregnant women properly and what to look for as far as red flags, but it's also the experience too. I've been treating pregnant women for the past 15 years, and it's not only like seeing them casually, but it's my passion. I
Yeah.
love caring for pregnant women. I've been there through my 4 pregnancies. It's not easy. And I just, it's not easy. And I've been there. I want to help other pregnant women be able to have a more successful, just take a load off their back during their pregnancies.
Yeah, literally and figuratively, pun intended.
Right.
Okay, who's an ideal fit for you?
Ideal fit. Oh, that's a great question. I love the pregnant women. Well, I've seen all sorts of pregnant women, like ones that come in right before their babies due, just wanting that one adjustment to help kind of make it easier labor and delivery. Or I've seen the pregnant women that come in at the very beginning, like they find out they're pregnant, they come in right away and kind of do a little bit of wellness care throughout their pregnancy to help prep them for labor and delivery. Um, But really, it's kind of the woman just looking for that more efficient pregnancy, kind of somebody who's um, wants the benefits of being out of pain, but also wanting the benefits for having um, helping our body function optimally, so we have a more efficient um, labor and smoother delivery.
Amazing. Okay. What does the process look like to work with you?
So first visit, you come on in, fill out the paperwork, and we do an exam. As part of the exam, I like to do these scans that I have. There's completely superficial. They don't affect the baby at all. The first scan is a thermal scan that we roll at the back. It looks for areas of heat along the spine, which tells us if there's inflammation in those areas. And then we do a surface EMG scan of the spine. So looking at muscle activities, so we can see how muscles are balanced. And then the last one's a heart rate variability scan to see how the body's handling stress, which we know pregnancy can be more stressful, a great stress, but more stressful. Um, and then after the scans, we talk for a little bit, and we have a hydro massage table in our office, which is just kind of to pamper people because we all need to be pampered, especially when we're pregnant.
Yeah.
Um, and then we get you adjusted that visit. And with the adjustments, again, they're all very specific for pregnant women, not to um, add any extra twisting or torquing on that pelvis because that's what we're trying to prevent.
Okay, great. And then from your standpoint and your lens, what does recovery look like in that transition from pregnancy postpartum? What is recovery? I know that's a question.
That is right. Oh goodness. Well, and especially because I mean, our core is gone, right? We just had baby, our core is gone. Our musculoskeletal system doesn't have that support it usually does. I mean, even with pregnancy, we have something sitting there supporting, I mean, some tension, some balance in there. And so after baby, it's like we're deflated for a little while and everything's pretty loose. Um, and I'll tell patients to come in just as soon as you feel ready to come in. And we tailor the adjustments to where they are. If you're like fresh postpartum, they're very gentle adjustments. And if you're further along, like 6 weeks plus postpartum, then we do a little bit deeper adjustments there too. Um, but yeah, your body just went through a marathon. So it takes
Mhm.
time to recover, right? Like those muscles stretched out, which need scar tissue work or work to help prevent the scar tissue, and then helping to make sure that those bones are lined up in the proper place, kind of through the adjustments so that everything comes better together nicely. And you do get a more efficient, faster recovery out of that too.
Yeah, yeah, wonderful. Okay. And then what is something that most people don't know that you think they should know about you, your services, chiropractic in general, anything?
Um, oh, that's a great question too. um, I would say most people come in for pain during pregnancy,
Yeah.
which is a great motivator. I mean, that's what motivates me to do a lot of things I do too. But it is the preventative nature of it too. We look at as chiropractors, we're known for dealing with pain, but we're actually better at being nerve doctors, where we help stimulate the nervous system to function at its best. And so, what I try to explain to patients is not only are we wanting to line everything up bone wise, but we want to make sure that there's no inflammation along the spine so that those nerves that come down through your spinal cord from your brain and go out through the holes in the spinal column in your low back, that there's no inflammation there putting pressure on them that affects those nerves that control your uterus.
Mhm.
Because you're growing a baby. You want those nerves to be functioning at their best if ever there's a time in your life, right? And
Mhm.
so helping to grow that healthy baby, and then when it's time for labor and delivery, the nerves are working so you have more efficient contractions. They're communicating with the brain, doing the best that they can.
Yeah, awesome. Okay. Is there anything that you want to promote to the audience, whoever's watching? Anything about your services, where you're like that kind of thing, like that, or just chiropractic in general can be whatever.
Yeah, I so my office is in Draper, Utah, and I do have a new patient special, just kind of making it easier for people to come in and try me out to see if we're a good fit because you need to find a provider that works for you, that resonates with you. Um, and so in our office, our new patient special is the entire first visit from kind of the consultation to that first adjustment is all $49. So it kind of gives you that step in the door. But what I will tell people too is when looking for a prenatal chiropractor, there's a website called ICPA ICPA for the number four kids.org. And you can go in there and find a Webster certified chiropractor in your area.
Mhm.
And so making sure that they're kind of not just Webster certified, but also experienced and worked with several pregnant women too.
Awesome. Okay. My favorite question.
Mhm.
What is the main thing that you want to be known for?
Um, I do. I really want to be known for working with pregnant women. It's my passion. I
Mhm.
love helping women through pregnancy. Um, I also love seeing those babies though.
Yeah. Right away.
Babies, oh, they are. Yeah. I'm done having my own babies, so I want to see everybody else's babies and
Love that. Same.
and just yeah, I wanted to be well, mainly the pregnancy, but I like seeing the babies after too.
Awesome. Awesome. Okay. Where can everyone find you? What's your website, Instagram, social media, anything like that?
Um, my website is www.summitwellnessclinic.com. And my social media, my Facebook page is Summit Wellness Clinic. And my Instagram is Utah Family Chiropractor. And so you guys can look me up there and reach out with any questions.
Perfect. Well, thank you so much, Dr. Kim, for coming on today and doing our spotlight series for the best in Utah pelvic health and diving in all these fun questions with us. Thank you so much.
Awesome. Thank you.